A local school district is one of the first in the country to partner with the CDC to study school-based COVID-19 transmission.
CBS 46's Melissa Stern joins us now with what they found.
Thanks to Marietta City Schools and health experts from several local agencies, we now have a better understanding of school-based COVID-19 transmission patterns.
Someone from the CDC reached out and they put us as part of a text study where every day we had to respond whether there were any symptoms or not.
As part of contact tracing efforts, families in the Marietta City School District filled out questionnaires, had phone interviews, and COVID-19 testing.
And that was intended to figure out what were the social patterns of a child. Like, did they wear a mask outside of school settings? Did they socialize? Did they stay at home? All of that became a big picture for us to determine whether it was community-based or school-based.
The study started December 1st and ended January 22nd.
Did we see school-based transmission? Yes. Was it something that occurred more often in elementary than secondary? Yes. Did it occur more often in extracurriculars? Yes.
It identified 9 clusters of COVID-19 cases involving 13 educators and 32 students at 6 elementary schools. More than half of the cases were linked back to 2 adults.
Now that we know that there's a greater risk and a greater pattern of adult-to-adult spread and subsequently adult-to-child spread, not as much relative to student-to-student or student-to-staff, that speaks overwhelmingly to the importance of vaccines for adults.
The study occurred while community transmission surged 300%. The district hopes this makes schools safer not only for them, but for all districts.
It could help our country study this disease and figure out how we can get back to normals.
The main takeaway, educators play a central role in school transmission. The CDC says the best way to minimize this is by vaccinating all teachers. Reporting in Cobb County, I'm Melissa Stern, CBS 46 News.
Melissa, thank you.